Good evening, you're watching The Big Story. I'm Olivia Quay with Dylan Ang coming to you live from the Straits Times newsroom. Coming up on the show, we have an exclusive interview with a Covid-19 patient who will be speaking to us from his isolation ward.
But first, schools and kindergartens will reopen next Monday as planned after the March holidays, but there will be stricter measures in place. All students and staff of schools, preschools and student care centres who were overseas during the school holidays will have to serve a 14-day isolation period when they return.
The announcement comes amid wide speculation among parents and students that the one-week school holidays, which began on March 14th, will be extended. In a Facebook post, Education Minister Ong Ye Kung said the decision to do so was one that wasn't easy, but that the ministry's priority must be to protect the education system by keeping students safe.
He also said that schools will continue to suspend all co-curricular activities and will get students to sit further apart. Preschools will also do more frequent temperature screening for all staff and students. We're joined now by the Straits Times senior education correspondent, Sandra Davie. Sandra, how have parents and students reacted to the announcement of the 14-day leave of absence?
Well, Darren, it's been a bit mixed actually. On the one hand, there are parents who are actually calling for all schools to be shut. They feel that their children may be safer that way. But then there are other parents who are quite relieved that MOE is going ahead and reopening schools because it's quite difficult for them to make alternative arrangements for their kids to be looked after. Yeah.
Do you know how many students will be affected by the LOA, Sandra?
No, the ministry did not give any figures for the students who had been abroad or the teachers. But Minister Ong Ye Kung, in his Facebook posting, did say it involves thousands of students and their families. As for the teachers, obviously it's not that many of them because he did say that there are enough teachers to keep lessons going.
Now, Sandra, for students who miss classes because of this notice, what are the measures that will help them catch up?
Well, the ministry is instituting home-based learning. Actually, at different points, schools already offer quite a bit of e-based learning where kids can access lessons through the student learning space. Some schools had also given packages and which include worksheets and different kinds of homework for them to take home and work on those worksheets. So basically, MOE's pledge is that their lessons will go on and they will not face too much disruptions in terms of the coverage of the syllabus. So I think kids need not worry. It's quite a tried and practiced thing these days in our schools, actually.
Minister Ong also said all CCAs have been suspended. Will that have an impact on O-level grades? As we know, active participation in your CCA can contribute to a better overall score.
Yes, I mean, CCAs do contribute to the score, eventual score. And some parents are already concerned about that and have brought it up with me. But on the other hand, I'm sure the ministry will look at what needs to be done going further. And they will definitely do some tweaks to ensure that kids are not in any way penalized by these measures that they have had to take, yes.
Right. Sandra, final question. MOE also announced stricter measures like getting students to sit further apart in the classrooms, canteens and other shared areas. What are the details of these social distancing measures? Would it also affect timetables and how classes are usually run?
Well, I'm sure parents, as teachers will adjust accordingly to ensure there's minimal disruption and there's proper social distancing. But basically, they're going to follow exam-style sitting where kids are placed further apart. So that you can't look at your neighbor's answers, right? And also it will be fixed seating, meaning that you will not move around, although the lessons might involve some sort of interactivity, but you'll ensure that that doesn't happen. So there's social distancing, even within schools. In canteens, there'll be staggered recesses, of course, which has already been announced. If there are group activities, it will be in smaller groups. So all these precautions are being taken. So I think parents need not worry. Yes.
Well, thanks for your time and insight, Sandra. Of course, we've been speaking to Senior Education Correspondent Sandra Davie. Schools will reopen on Monday as planned, but with stricter measures in place. And we want to hear from you as well. Share your thoughts with us by leaving a comment below.
Singapore saw 47 new cases yesterday, an all-time high. This brings the total number of cases to 313.
33 of the new cases are imported and 30 of them involve Singapore residents returning from abroad. And so in light of the escalating imported cases, authorities have said that all Singaporeans and residents returning to the country will all have to serve a 14-day isolation period, while people in the country should defer or travel overseas.
We're now joined by a COVID-19 patient who is currently in an isolation ward at National University Hospital. He's Raymond Sim, a pastor at Lighthouse Evangelism Church, and he's known to the public as case number 227.
Raymond, we understand you caught the virus in France, where you were there from March 7 to the 12th, and then you went to NUH on the 14th, and your positive test results were confirmed the next day on the 15th. But between coming back from France and going to the hospital, you didn't go to work at Lighthouse. Now, Raymond, tell us what you experienced, from when you exhibited symptoms, your flight back to Singapore, the health checks you underwent, etc., until this point.
Yes, on the second last day of my trip, I start to feel a slight itch in my throat. But to me, this slight itch is normal because my nose and my throat is usually sensitive to cold air. So I put it aside. But it was actually a very smooth trip to Singapore. Nothing. Nobody stopped me. I didn't have any fever, no symptoms at all except the itchy throat. The only thing I was troubled in the trip home, that was the announcements made in the news that Singapore actually asked for a stay-home notice from those returning from France, Germany, with effect from 16 March. Actually, I didn't get affected, because I arrived on the 13th of March. And although it did not affect me, there must be something really wrong in Europe at that time. Although everything was normal when I was there, except for the absence of mainland China tourists in Europe. Yeah.
I see. So does that mean that you weren't swabbed at the checkpoint when you came back?
Nope.
Right.
Not at all.
Right, because you weren't exhibiting, I guess, obvious symptoms. So Raymond, I just want to find out, how are you feeling right now, physically and emotionally?
I am actually having a little bit of headache, a persistent headache. My temperature actually subsided already. Yeah. And actually, when I was admitted, I was emotionally down. And I tried to hide it away. Feeling the feelings of guilt when my house was put on stay-home notice. Questions start running in my mind. How did I cause this danger to my family, the ones that I love, and I'm supposed to protect them? And because of this infection, I felt that the services in my church has been suspended. Self-condemnation and regret starting to creep into my heart, and I felt that I'm supposed to be helping others, but a lot of the assurance came from my colleagues, family and friends, and I managed to break out of it. I guess shame is one of the biggest deterioration to freedom in life. When we mess up sometimes due to situations that happen, which is not even under our control. But when that happens, I think God will uphold us in His hand because His grace is sufficient.
Raymond, what medical treatment have you received over at NUH?
They gave me paracetamol and they gave me cough syrup, and they are trying out a new drug for me, but I don't think I can disclose anything yet.
How how often have you been checked by the medical staff over at NUH?
Oh, they actually come in 5 to 6 hours every 5 to 6 hours. The nurses will come in to check my pulse, my BP, my temperature. They will come in to give me my medicine, and they come in to give me my meals as well. The doctors actually come in to take my blood and for tests, and the swab test, of course, every day. Actually, the swab test is really painful. Up the nose, very, very uncomfortable. Yeah.
Raymond, share a little bit about the types of meals you've been getting and even the things in your room that have kept you occupied.
Yeah. They provide breakfast, lunch, dinner, and you can choose Chinese, Muslim, or Western. But unfortunately, the food is quite bland. That's hospital food, I guess.
Yeah.
Anyway, my appetite is not as good as well, so looks like I'm going to be discharged a trimmer person. Well, in this room, there's lots to do actually. There's my TV that they provide, and I brought a book with me, and this is a very good book to read. Yeah, and I have my phone to connect with my family and my friends, and of course I play music from my phone as well. I read my Bible, and the bed is just right for me to sleep and take a rest, which is so important to me at this point when I'm feeling very sick. Of course, God is in my room, and He gives me peace.
Right. Well, Raymond, why do you decide to share your story, and in doing so, revealing your identity as well?
Well, actually, my friend who is your colleague in Straits Times, she asked me if I can help to share what is it like to be in isolation. Being in isolation is not that bad. And I want to just tell everyone who is afraid of reporting yourself, it's okay to come in. It's a great time where you can come in to reflect and to talk to God even, a time where you get more time to do the things that you cannot do because Singapore is such a busy place. Things that you cannot do because of on a normal day, Yeah.
Well, we want to thank you for speaking with us, Raymond. We wish you and your family all the very best.
Thank you so much.
It's been 2 days since Malaysia's movement control order kicked in. Singapore's Trade and Industry Minister Chan Chun Sing said most wholesalers and retailers received their goods from Malaysia as usual on the first day of the lockdown.
In a Facebook post, Mr. Chan said products like pharmaceuticals and baby diapers have also been allowed through the checkpoints. But there's been feedback from companies that some trucks bearing non-food supplies have not been let through. Mr. Chan said that economic agencies are working to minimize disruption to supply lines. Some companies have activated alternative transport arrangements via sea and air freight to get their goods from Malaysia to Singapore.
Yesterday, the Johor state government said that it hopes to reopen the border with Singapore within the next few days, with more stringent health checks on both sides of the border. Joining us now live from Kuala Lumpur is our Malaysia correspondent, Nadira Hani Rodzi. Nadira, it's the second day of the restricted movement order. How has the situation changed in Malaysia from yesterday?
Well, we see more Malaysians adhering to the order compared to yesterday. I believe this is partly due to the enforcement done by the police. About 8,600 police personnel have been deployed nationwide, and they are actively setting up roadblocks. So basically, those who are seen roaming around are approached and sent home if they do not have a valid reason to be out. The Malaysia's defense minister also has warned that if people continue to defy the order, the military might be called in to enforce it.
Now, Nadira, on a positive note, the Johor government said that it hopes to reopen the Johor border within the next few days. How likely do you think this is going to happen?
Both Malaysia and Singapore are still in discussions on this, so we should not speculate on the outcome at this stage. But of course, it would greatly ease matters for the over 400,000 people who make the crossing between Johor and Singapore every day to work or study or supply goods. So I guess it would be a win-win situation for both sides, as livelihoods are being affected. Those who can't cross over for their jobs, may be forced to take no pay leave.
Well, thank you, Nadira, for speaking with us. That was, of course, Malaysia correspondent Nadira Hani Rodzi. And do visit straitstimes.com for all the developments across the causeway.
More COVID-19 headlines beyond our borders. Europe has surpassed China in its number of confirmed cases and deaths, with more than 85,000 infections and just under 4,000 fatalities. The city of Wuhan, meanwhile, reported 0 new infections for the first time. Imported infections accounted for all of the new cases in mainland China, with 34 reported yesterday.
Organisers have cancelled a large religious gathering in Indonesia's South Sulawesi province. It was scheduled to begin today, but fears of a spread persist as more than 8,000 Muslim pilgrims across the country had already assembled in the provincial town of Goa.
Australia's biggest airline, Qantas, said it will stop all international flights by late March for at least 2 months. The airline will be suspending 20,000 of its 30,000 staff during the shutdown.
In fact, the International Labour Organization said that as many as 25 million people around the world could lose their jobs as a result of the pandemic. The organization called for an urgent, internationally coordinated policy response to reduce the impact on global unemployment.
The Progress Singapore Party has set its sights on 8 GRCs and 7 SMCs at the next general election, whenever that will be. Party Chief Tan Cheng Bock is also set to lead a team in West Coast GRC.
West Coast GRC includes the Ayer Rajah ward, where Dr. Tan was the People's Action Party MP for 6 terms. According to the new electoral boundaries, the GRC will take in parts of Choa Chu Kang GRC and Hong Kong North SMC to become a 5-member constituency with more than 144,000 voters.
Larger GRCs are generally seen to favour the PAP, as opposition parties may find it harder to put together a larger slate of candidates. In the 2015 election, the PAP won West Coast GRC with 78.57% of the vote against the Reform Party led by its chief Kenneth Jayaratnam. We're joined by journalist Fabian Koh, who spoke to one of the PSP officials last night after their party meeting. So Fabian, PSP targeting 8 GRCs and 7 SMCs. We know, of course, that Tan Cheng Bock is very likely to anchor a team in West Coast GRC. Where else do you foresee the PSP contesting, and where do they stand the strongest chance, besides West Coast, of course?
Okay, well, the party's stronghold basically is in the west of Singapore, given the alignment with where Dr. Tan Cheng Bock was MP for almost 30 years. So I understand that Assistant Secretary General Leong Man Wai will be leading the party's B team, the second strongest team, in another ward in the west. So perhaps that will be Jurong or Choa Chu Kang. As for the other constituencies, I think they probably will be willing to compromise on those during the discussions with the other parties. As for their strongest chance, well, I think we will have to wait and see the lineup and caliber of the candidates when the time comes.
Now, Fabian, it's of course the party's first electoral outing. Do you think the PSP has cast its net too wide with this ambition of contesting 15 constituencies?
Well, the Assistant Sec Gen Leong Man Wai, as I said, he seemed confident when I was speaking with him last night. It's a potential total of 44 seats, and they also have 13 reserve candidates. So while we probably will have greater clarity on this in like the weeks ahead, we know that among the party members, they have former PAP members, they have former members of other opposition parties. So I guess the political experience is there.
Fabian, let's focus on West Coast GRC. It includes the Ayer Rajah ward, where Dr. Tan was the PAP MP for 26 years until it was absorbed into West Coast GRC back in 2006. Do you think Dr. Tan still has the support of the residents there?
Well, the party has been focusing a lot of its outreach efforts in the western side of Singapore, in that whole area. So in fact, like earlier this year, it conducted its first door-to-door visit in that GRC. And also since like last year, Dr. Tan has been on record a few times, just saying he told residents there, "I'm coming home." When you say this kind of thing, of course, you expect something, right? Yeah, and also he told me before that he understands since the time when he was MP until now, the patterns on issues like housing, like education, for example, they definitely have shifted. So I'm sure he will be working that GRC with that in mind. Yeah.
Now, which other parties are expected to contest West Coast GRC?
West Coast GRC, okay. For one, the incumbent, the People's Action Party, they will definitely run there. Yeah, it's currently led by the Minister for Communications and Information, Mr. S. Iswaran. Also the Reform Party. The Reform Party will be contesting there. Chairman Andy Chu has told me that the party will seek to pick up where they left off from the last elections. And we noticed that if this goes ahead, then we can. While three-cornered fights usually they don't favor the opposition that much because it splits the votes, right? Actually, this time round in West Coast, observers have said that anyone challenging there will actually face a challenge simply because it's Dr. Tan Cheng Bock and his branding. Yes.
Well, thanks for your time, Fabian. That was journalist Fabian Koh speaking on the Progress Singapore Party's ambitions of contesting 15 constituencies in the GE.
And those are our top stories for today. For more news and videos, visit straitstimes.com. And once again, I'm Dylan Ang together with Oliver Quay. Join us tomorrow for more stories on The Big Story.